Hello, and welcome to M Health Solutions Holter Patch instructional video for healthcare professionals. In this video, we will demonstrate the steps to correctly apply the Holter patch to a patient and to provide the necessary information for the patient to successfully complete the test. Starting a patient on the M Health Solutions Holter patch is simple and only takes about 3 to 4 minutes to complete. The Holter patch kit contains a Novi device, a referral form, an adhesive patch, a symptom diary, a patient instruction sheet, a bubbled return pouch, a lead wire attached to an electrode, and a prepaid return envelope. Patch location and skin preparation. Briefly assess the area for an appropriate patch placement. For adults, the patch should be placed on the left side under the clavicle. The Novi device should be squared at the mid-clavicle line with the power button at the bottom. For neonatal and pediatric patients, the patch should be placed in the center of the chest, with the top of the patch just below the clavicle at approximately the second intercostal space. There may be special considerations that require a slight relocation of the patch. If a patient has a pacemaker, do not place the patch over the device or on any scar tissue. For women who have large breasts, attach the patch slightly higher on the chest, trying to avoid any creasing area that would buckle the patch. Before applying the patch to the patient, it is important that the skin is properly prepared to ensure the highest quality data. Be sure to thoroughly clean the area with alcohol or water and assure the skin is dried fully. The skin may appear light pink as it has now been lightly abraded. To ensure patient comfort and to attain high-quality data, shaving may also be required. Holter application. Firmly press each of the 4 snap buttons on the back of the device onto the patch, making sure that they are firmly connected. Then, turn on the device by pressing down and holding the power button until you see the green light. The green flashing light will blink for approximately 30 seconds. Peel the backing from the patch and with the power button pointing downwards, securely apply to the patient. The patch must be applied to the patient within 30 seconds of the green flashing light. Additional lead wire application. Simply locate an approximate V5 area. This area is on the left anterior auxiliary line around the 5th intercostal space. Alter as needed. Peel the backing off the electrode and attach to the prepared area. Leave enough room for the patient to comfortably move around without the risk of tugging or loss of connection. Attach the P end of the lead wire to the snap located at the bottom of the patch. Additional information. Remind the patient that the device is water resistant and encourage light showers only. If patients have any questions, direct them to the instruction sheet in the kit or the patient video on the M Health Solutions website. If you see a red light or you suspect the device may have powered off, please give us a call. Following the patient hookup, fax us the patient requisition to 1-888-636-0181 and save a copy for your patient records. Contact info. If you have any further questions, feel free to contact us at 1-888-636-0186. Thank you.